response to the COVID pandemic is falling apart at the seams. Daily infections up, hospital admissions up, and deaths up too, with officials across the country meeting the moment of national crisis in strikingly different ways. Florida, where masks are not required, seeing some of the worst days any state has seen in this pandemic. While here in California tonight, also facing out-of-control infections, the governor has just reimposed statewide restrictions on everything from gyms and salons to restaurants and churches. A lot of moving parts to cover tonight. Let's start in epicenter Florida with Kerry Sanders.
In California tonight, an about face. What had reopened now closing again. The statewide mandate includes closing all bars and indoor establishments like restaurants after more than 60,000 new cases statewide in the past week. In 80% of the states, gyms and hair salons also ordered to again shut down. Some business owners say a second shutdown will close them forever.
A lot of really good people are going to lose their livelihoods and go bankrupt and Lord knows what, because people wouldn't wear a mask.
In Florida, which remains open for business, anxious residents, some without symptoms, began lining up at 1:30 this morning to get tested for COVID. Florida now the poster child for what's gone wrong. More than 12,000 positive tests reported here today. This after Florida broke the single-day record in any state on Sunday. 15,300 positive tests. And you're here because?
I wanted to test myself. It broke the record. I seen all the 15,000 and now, it's freaking me out.
The unabated increase over the last 2 weeks spreading in most of the country.
We keep looking for this reason why we have this high contagion. The reason is us, okay? There's no boogeyman, it's us. Unless we change behavior, we can do all the tests in the world you want, you can get all the contact tracers in the world you want, it's not going to make a difference.
Behind the statistics, the faces of those who thought they were too young to get sick. 42-year-old John Place on a ventilator after his 21-year-old son came home from a friend's house where he'd taken off his mask. The entire family now testing positive.
I feel like I'm living a nightmare, like it's a bad dream and I can't get up from it.
Doctors say they're increasingly seeing younger patients who tempted fate, attending so-called COVID parties where they intentionally tried to get the virus or prove that it's fake. In San Antonio, a 30-year-old who attended one of those parties died.
Just before the patient died, they looked at their nurse and they said, "I think I made a mistake. I thought this was a hoax, but it's not."
Tonight, a deadly virus continuing to spread as health officials urge caution while trying to ease fears. Kerry Sanders, NBC News.
I'm Miguel Almaguer. Tonight across the nation, healthcare workers are sounding the alarm once again.
Our hospitals are overwhelmed. We have 7 hospitals that are at maximum capacity right now in Miami-Dade alone.
With hundreds of Americans dying every day from COVID complications.
We see a lot of patients, and they're both young and old, that are getting very sick.
The surge in cases is flooding hospitals in hotspots like Phoenix.
We're at over 100% capacity, if that's possible. But every place is a potential bed. We have a person.
In Arizona, nearly 1 in 5 are testing positive for the virus. In Texas, where the death toll is climbing, the scene is just as grim.
You see these warehouses of people on life support machines. It's dire when you're counting how many ventilators you have left. Do we have 2 left? Do we have 6 left? That's dire.
Their warnings reminiscent of those we heard from doctors and nurses in New York months ago during their darkest days. The CDC estimates nearly 100,000 healthcare workers have contracted COVID, with the death toll at roughly 800.
Every healthcare worker is working nonstop. Our workforce is also falling sick.
As California begins to close in on New York's record number of COVID cases, some hospitals do have room for new patients. But hard-hit regions like Los Angeles are in trouble.
It's exhausting and a little demoralizing.
After another grueling overnight shift, Nurse Jenny Wong Swanson says healthcare workers are tired and frustrated.
It does feel like it's out of control. I've never been in a situation in my career where somebody died because we didn't have enough resources.
Tonight, the grim reality on the front lines of a fight far from over. Miguel Almaguer, NBC News, Los Angeles.
Testing troubles are increasingly bogging down the nation's coronavirus response.
Delays in testing and inadequate testing are making people sicker, are making the outbreaks bigger, and are leading to more deaths.
The Trump administration has blamed some testing problems on mismanagement at the state level and says the U.S. did more than 800,000 tests on Friday.
We test more than anybody by far, and when you test, you create cases.
But today, the president's former chief of staff wrote an op-ed for CNBC. I know it isn't popular to talk about in some Republican circles, but we still have a testing problem in this country. My son was tested recently. We had to wait 5 to 7 days for results. That is simply inexcusable at this point in the pandemic. In North Carolina, Hugh Huffstutler was tested, then isolated in his bedroom in limbo.
It's insane to me that it still takes up to 2 weeks, 7 days, who knows, in order for these results to come back.
Public health officials say skyrocketing demand is creating a shortage of testing supplies, such as swabs and reagents, the chemicals needed to conduct the tests. The delays, critics say, are making an army of contact tracers paid for by taxpayers essentially useless.
Frankly, when you have a state like Florida that's on fire like this, contact tracing almost becomes irrelevant. It can't be done. It's kind of like trying to plant your petunias in the middle of a hurricane.
And in Florida, there's mounting frustration that while ordinary patients wait in long lines, athletes are getting tested frequently. One NBA player posting on social media that he's been tested 20 times since arriving in Orlando for the season. Now the race is on to develop quicker methods. At Arizona State University, researchers are aiming to conduct 16,000 tests a day, up from 2,000 by analyzing saliva. Here in New York City, some patients are waiting more than a week for their test results. The mayor here is urging the federal government to invoke the Defense Production Act to expand lab capacity. Lester?
Yeah, something we can't afford to get wrong. All right, Gabe, thank you. The government...
It is not getting any better here in the state of Florida. Florida reporting yesterday more than 12,600 cases, and new this morning, we're learning about a big issue that's been lurking under the radar, and that is the need for medical personnel. We just learned this morning from Jackson Health that 200 of their medical personnel are out with COVID-19. The positivity rate for all of the employees that they tested was 23%. That's why it's no surprise that Governor Ron DeSantis announced yesterday that he's upping the number of nurses that he's deploying across the state to 3,000. Here's the reality on the ground in Miami-Dade County. The positivity rate here is 28%. When it comes to hospitalizations, the number of hospitalizations of patients with COVID-19 is 2,000. When you look at that number, the percentage increase in the past 13 days, it's up 68%. The number of ICUs needed, 69%. The number of ventilators needed, 109%. Right now, there are 200 people on ventilators in Miami-Dade County. I just checked. The number of ICU hospitals across the state that are at capacity with 0 hospital ICU beds available is 48. 8 of them are right here in Miami-Dade County. Now, as leaders refuse to roll back any of their reopening plans, the frustration from residents is boiling over. I was at a Governor Ron DeSantis press conference yesterday when Tomas Kennedy interrupted the governor with this. Take a listen.
So I think the
breaking cases every day, and you are doing nothing.
So I think
information, and you are misleading the public. Over 4,000 people have died, and you are blaming the protesters. You guys have no plan, and you're doing nothing. Shame on you.
Now, I talked to Kennedy after he was escorted by security and Allison. He said he was frustrated, that he wanted his voice to be heard, that he's tired of the failed leadership, and that one simple thing that Governor Ron DeSantis could start doing is mandating masks statewide.
Rosa, thank you very much.
All right, joining us now, CNN Chief Medical...
Back in March, when all of the hospital workers started getting sick, that's when it was like, how are we going to get out of this? I mean, when colleagues are caring for each other And, you know, Sanjay, as you point out, I guess we should just brace ourselves for the death rate to begin spiking, because we were in that respite where, okay, I guess it's just younger people now getting sick. I guess it's just 20-something-year-olds, but now they're infecting their grandparents. And so does that mean that we should prepare ourselves for a spike in the mortality rate?
Yeah, I mean, sadly, Allison, I you know, as I've said so many times on this show, you know, I get no joy in talking about this. I mean, these are terrible things, but sadly very predictable as well. Let me show you something that we showed on this program back in March. This goes back to 1918, and you know, there are lessons to be learned throughout our lives and certainly throughout history. If we go look at what happened in 1918, or if we have that graph, we know that there was this first wave of infections and subsequently deaths, but it was really the second wave that ended up being so problematic. Where are we right now? If you look at this graph, where are we in the course of this pandemic? Well, we're still sort of in that first wave over there, to the far left of the screen. We haven't really had a second wave. We haven't had the luxury of a second wave because we never really got out of the first wave. We're still spiking in this first wave. But the concern, Allison, exactly to your point, and again, very predictable, unless we do something about this, is that the second wave, because you have not only more virus now in the community, far more than we had in February and March, but it's predictably going to start affecting older people. And the hospital capacity ultimately is what really changes that mortality rate. The virus itself, you know, if someone were to ask, look, put 100 people in a room, they all get exposed to the virus, what is the mortality rate here? The reality is we still have a hard time answering that question because it's so affected by how likely someone's to be able to get hospital care, what kind of care they're going to get, all of that. Some people said it's around 1%. 1% of people who get infected will die from this. But if you don't have enough hospital capacity, you're going to have preventable deaths, and that starts to drive up the mortality rate. If you do the calculations on the right side of the screen, it's somewhere between 3 and 5%, much higher than it should be.
It's interesting, Sanjay, that California stepped up and is beginning to close down some of the things that they'd opened. They also announced the schools in San Diego and Los Angeles counties will not be reopening physically in the fall. California is in a little bit of a different place than Texas and Arizona and Georgia and Florida. It's still bad there, but their positivity rate is actually only half of what those other states are. So in some ways, they're doing this before or in a place that is better off than Texas or Florida right now.
Yeah, I mean, you know, it's interesting, John, because it's all the context, right? I mean, I think Florida was earlier in terms of when they started talking about shutdowns previously, and I think a lot of the country was thinking, really? You're going to think about shutting things down? Is that really necessary? And then it became obvious, you know, abundantly necessary and abundantly clear that it needed to be done. I think we're sort of seeing the same thing here as well. I do worry that even though they are ahead of this compared to places like Texas, you know, if you don't get ahead of the curve very quickly with this virus, you're behind it. And I worry about that even in Florida. I will say that, you know, we can identify the biggest sort of contributors to spread. And there's no question that indoor gatherings that are unmasked because people are eating and drinking, such as restaurants and bars, closely clustered together, those are going to be the biggest source of super spreading events. There's no question about that. I think the question now for California and for, you know, several states now around the country is, can you do these sort of surgical strikes or these minimally invasive procedures as opposed to going into a more full shutdown mode? Nobody wants to go into a full shutdown mode. I get that. But is that sort of aggressive therapy going to be what's necessary, you know, over the next several weeks in order to really stop the transmission of this virus, to sort of just stamp it out for a period of time so that we can get our arms around it again?
The nation's most populous state is reinstating stricter stop the spread restrictions. And its two largest school districts, Los Angeles and San Diego, say the numbers are so bad they already know children will need to learn from home this fall. Because of its size and its diversity, California is often a first alert. And our state-by-state coronavirus tracking makes clear, you see it right there, a lot of places at this moment anyway are trending in the wrong direction. The president won't acknowledge this. In fact, he flat out ignores it, saying those talking about slowing the reopening or keeping students at home are trying to hurt his re-election chances by hyping the coronavirus risk. Once again, though, is the president's own advisors making clear he is out of touch with reality. Listen closely.
We all know that kids need to be back in school physically for all the reasons we talk about: social and emotional health, nutrition, eye screening, discovery of child abuse, all those things that are very important. But we have to get the virus under control. And if we get the virus under better control, clearly kids can get back into school safely.
The but and the if right there are quite telling. Unlike his boss, Admiral Giroir is willing to acknowledge the science and acknowledge the obvious. The virus is not under control today. And if things don't improve considerably, back to school in many places will just not be safe. The Admiral does say he does see some light at the end of the tunnel. How far off is that light? Well, the mayor of Philadelphia just today making clear he sees a long road ahead. The city today, Philadelphia again, says all large public events like festivals, parades are prohibited, get this, through February 2021, 7 months from now. The judge leading the coronavirus response in Houston says if you want a better new normal anytime soon, Americans need to put on a mask, stay out of bars, and think about others.
We have to bring that curve down, and the more we buckle down, the faster it'll come down, the faster we'll be able to drop our kids off for school, to ask them about their day, to get on with our economy, not fully open until there's a cure or a vaccine, but a new normal.
The numbers in our map tell us the challenge is as great as ever. Let's take a look, and let's just start with a number. Look at this right now. The 7-day average of new coronavirus cases here in the United States now above 60,000. That's never happened. This is the first time our 7-day average of new cases is above 60,000. You see the current average just shy of 61,000. We go back in time to the middle of April when we thought we might be at the peak. It was 30,000 back on April 26th, the 7-day average of new cases. Look at that. That's April. 30,000. Here we are today, over 60,000. The summer surge is with us. Let's look as we go through to the trend map right now. This map is just plain ugly. There's no other way to describe it. 37 states have their cases going up this week compared to last week. 7 of those states, a 50% higher rate of growth in their cases this week than the week before. That's the darkest red. You see it there. 7 states, the beige holding steady. 6 going down. You see the lighter green states out there. Those are the 6 going down, but 37 states heading in the wrong direction. This is also a warning sign here in these states. Look at the positivity rate. South Carolina, 17% plus. Florida, almost 19%. The same in Mississippi, 17%. In Texas, more than 26%. That means, yes, there's a lot of testing. The people in those states taking the tests, high positivity rate turning back. That means they do not have the virus under control. If you look at Arizona, perhaps, and let's hope a glimmer of hope here. You see the 7-day moving average starting to trickle back down in the last couple of days. Let's hope that continues. Perhaps Arizona starting to reflatten the curve there. Hospitalizations, too. You see the rise in June and into July. Some indication in recent days that that might be flattening, so perhaps Arizona starting to flatten. We'll keep an eye on that. Florida has been a point of conversation for months, but especially in recent days as it sets daily records. You see here the 7-day moving average still trending up in Florida. Yesterday's case numbers not as high as the days before, so we'll keep an eye on this, but the 7-day average, which is how you track it, it's best to track averages heading up, which is why we start with CNN's Rosa Flores live in Miami for us. Rosa, every day at the top of the program, we've had some numbing numbers. Where are we today?
You know, we're waiting for the Florida Department of Health to post those numbers. But, John, we're also learning about a new concern in Florida, the need for medical professionals. We're learning from Jackson Health this morning that 200 of their employees are out with COVID-19. That means they're going to be out for 10 to 12 days. And the positivity rate of all of the employees that they tested is 23%. Governor Ron DeSantis announcing yesterday that he is upping the number of medical professionals that are going to be deployed across the state from 1,000, which he announced last week, to 3,000, which he said yesterday. An infectious disease expert here in Miami-Dade County calling Miami-Dade the epicenter, comparing it to Wuhan, China. Here's the reality on the ground. The positivity rate up to 28% yesterday. This is according to county data, which also shows that in the past 13 days, the number of hospitalizations have increased by 68%, the number of ICU units up by 69%, and the number of ventilators up by 109%, which begs the question, how much time does Miami-Dade have? How long is it going to take before leaders here shut down? Here is Miami Beach Mayor Dan Gilbert.
I suspect if in a week or two this is not changed in any way, then we're all going to do it. And whether or not the governor wants us to or not, we'll do it. The county will do it. Lots of the cities will do it. It'll just be a shelter in place again